Back pain affects 80% of Americans at some point in their lives. A new study finds many of them are not getting recommended treatments. Dr. Norman Marcus is Director of Muscle Pain Research at the New York University School of Medicine. Welcome.
Good morning.
So what does this study tell us, and why is it significant?
The study tells us that we're not getting the recommended treatments. The first one is, if you have back pain, it should be treated simply with simple drugs like Motrin, ibuprofen, naproxen, Aleve.
Over-the-counter drugs.
Over-the-counter drugs, not drugs like morphine or oxycodone. What the data shows in this study is that there's a one-third drop in the use of the anti-inflammatories, Motrin and ibuprofen, and a 50% increase in the drugs like oxycodone. Well, the problem with that is that we initially thought that these over-the-counter drugs might harm your heart, so people got scared, and we started to use more of the opioid drugs, but they cause more constipation, but worse than that, they can kill you. So the number of deaths from prescribed painkillers has gone up tremendously, and we have a whole move in the country now to suppress their use. Perhaps an over-response, but we see how difficult it is because the suggestion is not to use them. The second thing is you should stay under the care of your family doctor, your GP or family practitioner, or in the women's case, a gynecologist might be your primary care doctor. Keep it simple. Stay with your regular doctor. Don't go to a specialist. What the data shows is that there's a 106% increase in referrals to specialists, more than double what we had 10 years before.
And why is that?
Yeah.
The reason is that the primary care doctor is overwhelmed now. There's just too much to do, and it's too complicated, and it's somewhat threatening prescribing pain medications. So you end up at the specialist. What's the problem there? That you then do the third thing that's not recommended. You get elaborate tests and treatments. So for example, the suggestion is not to get an MRI or not to get a CT scan. Why? Because it's always going to show you something. 90% of the MRIs of the low back in adults are read as abnormal.
90%?
90% are read as abnormal. So if you get an MRI, I guarantee you it's going to be abnormal. In fact...
And then I'm going to think I have to do something about that.
Right.
Yeah.
So 40% of people on the street with no pain have herniated discs. 70% have degenerated discs with no pain. So then we end up pursuing what we see on the imaging study, which has nothing to do with your pain.
I've heard that people that suffer from back pain, though, say it's the worst possible pain that you can have.
Well, you feel like you're going to die, right? You say, this is so bad. Do whatever you want to, doc.
Yes.
If you want to operate, it's okay.
Yes.
Right.
You know, here's what's interesting. You're the second doctor on this program today who said we should not necessarily look at all these sophisticated tests as a prescription for what we should do.
Yes. We should do a physical examination, which we're not doing. You know, we've lost the art of touching the patient. We're stuck on looking at the imaging study, lab studies, and you've gone to your doctor. The doctor sometimes doesn't even look at you. He looks in the computer and doesn't touch you and looks at all the data. That's not everybody, but that's too much.
It seems to me that doctors need to do a better job of explaining this to their patients.
Absolutely. And, you know, it's a simple problem. We need a simple solution.
Great to have you.
Thank you, Dr. Norman Marcus.